It has almost been 4 months since the National Institutes of Health released a study associating hair straightening chemicals with uterine cancer. Although this type of cancer is rare, researchers found that women who reported using the products at least 4 times the previous year were more than twice as likely to develop uterine cancer compared to those who did not. The study warns that Black women may be more at risk because of frequent use of these products. So now that people have been able to digest the research, I got more answers from the lead researcher and talked with a local professional to find hair care alternatives for those who may be considering stopping their use of these products.
Hair is very strong and healthy.
At 35 years old, Brittany Church has a natural, thick, full head of hair. She says she got a chemical relaxer to permanently straighten her strands when she was around 7 years old, but stopped getting them in her early 20s.
Well, my hairdresser at the time said that it wasn't super healthy and it wasn't needed.
Although Brittany believes her stylist was referring to relaxers thinning her hair, research from the National Institutes of Health have found an association between hair straightening chemicals and an increased risk of female hormone-related cancers. A decade after ditching relaxers, Brittany was diagnosed with stage 1 breast cancer at 32 years old.
Do you believe your relaxer use had anything to do with it?
I don't doubt it. Could be.
Because of her cancer journey, Brittany began running hair care products through the apps Think Dirty and Yuka. Both are designed to alert users of hazardous materials within products. When a low rating is given, Yuka even provides recommendations for selecting healthier alternatives.
We still use the straightening comb.
LaDosha Wright of the Reverence Design Team Hair Salon in Cleveland Heights says professional stylists are available to help.
What is your advice for people who are concerned and what they should do with their hair?
Yeah, I would say follow your gut. If your gut is that you don't feel this service, then you just don't do it.
LaDosha and her team have helped clients style their natural hair into press and curls, afro bobs, 2-strand twists, braids, and locks.
You have to do what's best for you.
Although Brittany's go-to styles are braids and custom-made wigs, she has advice for those who aren't ready to give up chemical hair straightening products.
I would definitely say do things in moderation.
And moderation is key. The lead researcher for the most recent study tells me less frequent use of chemical hair straightening products was not as strongly associated with risks. So this suggests that decreasing your use may be an option to reduce the potential for harmful exposure. But Maureen, the lead researcher, wanted to stress that they did not prove that these chemicals and the hair straightening chemicals, the products, that they cause the uterine cancer, but they found an association. So she says that more research needs to be done.
Yeah, and not to put you on the spot, but I did ask you during that piece if there was a class action lawsuit, because you think of things like the baby powder lawsuit.
Right.
So there are some?
There are some, and actually Brittany, she filled out a form online because they say, hey, have you developed cancer after using hair straightening products? And, you know, in the Black community, they call it relaxers. And so she said that she actually signed on to see if she can be a part of that class action.
Yeah, I mean, sometimes those are the actions needed to see some change in the industry.
Even LaDosha, she says like, hey, she's kind of critical of the research because again, it doesn't say it link and it causes it. So she says, yeah, you don't need to be hyped up, but that those relaxers and the hair straightening products, they do need to be reimagined, do need to be redesigned so that they can be more safe for people.
Yeah, all right. Danielle, wonderful story.
Thank you.
Very eye-opening. I'm sure that's going to spark a lot of conversation.